Everyone, my name is Lata Patil, ICA executive and the host for this session today. Welcome. We'll be starting soon, but before we begin, I have a request. I would like all of us to observe a moment of silence in memory of a life tragically lost 2 weeks ago in this country, which has unleashed a torrent of pain and grief. So let's start. Now, it's my privilege this evening to welcome you all to this exciting new conversations, and a special welcome to those who are joining us from India, as well as a welcome to those who were with us last October when we had our first conversation about becoming an agent of change. This is the first session of this new series of conversation ICA has planned, following the same pattern we set at that last conversation, focusing on the 4 issues that are important to us at ICA. That would be health, education, women's empowerment, and environment. So glad that some of you who were with us last October have joined us this evening to continue that discussion. That discussion was all about igniting the spark, to take the first step to being an agent of change. And for some of you, it was about how you want to continue to participate in social development here locally and in India. The question for all of us has always been, what can we do to make a difference in people's lives? The current sessions are being organized to connect you to resources and to get an understanding of how leaders are tackling some real pressing issues during this pandemic, understand the challenges they face, and get some of the specifics of the work that's going on in their NGOs or local organizations. We hope this will give you a lead into the multiple trajectories that can move you forward to incorporate social change into your own life. We also want to acknowledge the sense of dual responsibility we all feel, whether it is seeing the long lines of migrant workers in India trudging along highways in heat, no shelter, no food, no water, or the long lines at the food banks right here in Silicon Valley. ICA in the last few months has shown that it doesn't have to be either or, and generously responded to needs wherever they have risen. We wanted to have these sessions much earlier in the year, but then came the pandemic, upending our lives and our plans, forcing us to face a new sense of urgency to be actively taking action on the impact that the pandemic is having on a range of social causes that are important to our community. The COVID-19 pandemic has emerged as a global health crisis, and we have seen a wave of grassroots initiatives and volunteers contributing to the virus fight. ICA is partnering with trusted nonprofit organizations in India and here locally in Silicon Valley to support frontline health workers and institutions responding to the coronavirus pandemic. Part of this conversation is also about how each one of you is responding, what steps are you taking, what challenges are you facing in reaching out, and what role can ICA play in all of this. But now let me welcome our guest, Anagha Amte, and our moderator, Kala Mehta. In the interest of time, I will only do a very brief bio, and over the course of the evening, I hope they will go over a bit more deeply into the work they're doing and the organizations that they belong to. Now, the Amte family is no stranger to ICA members. Several of them have over the years been our guests, and they have very generously shared information about their work and their goals with us. Anagha has been working in Lok Biradari Prakalp for several years now, which actually was started by Baba Amte in Hemalkasa for improving conditions of the primitive tribal people located deep in the forests of Maharashtra. He, and later on his family, went on to establishing schools for tribal children, rainwater harvesting projects, and livelihood projects for self-help groups, hospitals, several community health centers in remote villages, plus clinics at each of these centers for pregnant women to get regular checkup and the treatment they needed. There are actually too many on this list to go on, so I'm going to stop right here, and hopefully Anagha will talk a little bit more about all of this during her presentation and her slide presentation. Now, Let's go to Kala Mehta, our moderator this evening. Again, Kala is no stranger to us here at ICA. In fact, it was her late father, Mahendra Mehta, who was the co-founder of this organization. So actually, she's part of the family here for us. Kala is an epidemiologist at UCSF, working on some of the COVID-19 modeling for counties in the US to help determine whether they will open back up again soon. She's also doing some work with race and ethnic minority communities, African Americans, Latinos, Native Americans, because these communities have been especially hard hit. It's my pleasure to invite them both to start this session. Just a few things to note first. This conversation will be about 30 minutes, and then we will move on to the Q&A feature and address as many as possible. But please do send your questions to the chat sections and add your first name, last name, plus any organization you're part of. Or if you want to speak, please raise the symbol of the hand that's there, and one of the co-hosts will let you in. Anagha, Kala, now take it away from here.
Anagha, shall I put on your slides?
Okay, thank you, Kalaji. Thank you, Lataji, for this very generous introduction. As you know, we have, today I'll be speaking mainly about health activities because this panel is about health. So, as you know, this hospital was started in 1973 by my in-laws. It was started by my grandfather-in-law, but it was taken over by my in-laws who are doctors. It was started in a hut. As you can see from first two slides, it began in a hut. But now, if you see the hospital, Kalachi, could you? Yeah, this is the beginning of the hospital where there were no buildings as such. Everything they were staying in a hut. But now we have a 50-bedded, a big hospital. If you can see it from the next slide, and a lot of facilities of doing blood investigations, X-ray, ultrasound, NICU for small babies, operative theaters. We see around 40 to 45,000 patients per year in the out clinic. 3 to 4,000 patients get admitted. More than 300 patients deliver in the hospital, and numbers are increasing. We also conduct 4 surgical camps. Could you share the next slide? Yeah, the Rotary Club of Nagpur and Minimal Access Surgery Association of India, they conduct surgical camps over here. Ophthalmic camps are conducted, and we have good wards to accommodate these patients. Next slide, please, Kalaji. So these patients are admitted. We have good facilities for them. This is talking about what we do in the hospital. We also have outreach centers. As Latachi said, 6 community health centers in remote areas, because during monsoon, these people cannot come to the hospital. They are cut off by rivers. So these community health workers, they are trained to diagnose and treat minor illnesses like fever, cough, cold, diarrhea, etc. Because if these are not treated, they could be life-threatening. And since last 2 years, we have also started monthly antenatal checkup clinics at these centers, and to provide care and create awareness about health during pregnancy. And these are gaining a good response from people. We can see it in the numbers because hospital deliveries are increasing. In last 4 months, we have been having more than 30 deliveries per month. So hopefully we'll be crossing 350 this year. And the other 2 activities, last 2 activities are, one is school health awareness program, wherein we talk to children about hygiene, how to prevent communicable diseases, and adolescent health and addiction control. And now we see with the advent of COVID, how hand washing has been so important, covering your mouth during coughing and sneezing. Everybody is putting stress on these things. So we are glad we had started it long back to our children, and hopefully that has helped them to prevent themselves from these diseases. Lastly, we have sanitary pad manufacturing unit. These are the women in the antenatal clinics where we conduct. There are around 10 to 12 every time. Lastly, the sanitary pad manufacturing unit, we produce eco-friendly, low-cost sanitary pads, and we provide them at very cheap rate to the girls in the hostel. And they are very eco-friendly without plastic. And we also install incinerators to burn these pads so that they do not create any pollution or health hazard. So that is all in brief. Over to you, Kalaji.
All right, thank you so much for that introduction. Did you want to describe what was happening in this circle of women?
Yeah, this is at one of our community health centers. Right now, we do not have any building as such. These are being conducted in the houses or in the premises of our health centers. So these are the group of the two girls in the maroon color in the left-hand corner. Those are our nurses. So, and these are the women who have come for pregnancy checkup. And after the checkup, we sit and discuss with them what do's and don'ts, what are the risk factors, what they should eat, and why they should visit the hospital. And because of these clinics, they don't have to come monthly for checkup. They have to come only twice to the hospital. So for sonography examination, and later for the delivery. So they are the traveling to hospital 20 to 25 kilometers or more is saved, and they come regularly and they get good care at home. So they are discussing some of the topics like nutrition with the women over here.
That's fantastic. Thank you so much for sharing all of the different things that you're working on, and also with these pictures that really bring the story to life. I think it really helps all of us here to have a perspective. Before, I was going to launch into some overview slides, but I think I'll shift that to the end, because I think the critical question for most of us when we see all of these slides is really, how has the COVID-19 pandemic impacted you and the women? Primarily, you are an OBGYN, so the women that you see. Could you describe that for us a little bit, and just give us an insight into your world?
Thank you. So COVID-19, luckily we have not had any cases of COVID-19 in our area, because though we complain of being secluded and cut out from the rest of the world all the time, this has been a boon in this particular situation. But it has affected the healthcare of the people because of the lockdown. It was generalized lockdown all over the country, irrespective of the situation, and which is very much correct. But in this area, there were no transport facilities. People don't have their own cars or anything to go to the hospital. So as a result, other diseases took toll. If you can see, the numbers are not available, but what people are predicting is the 25% of the deaths were preventable, and these were non-COVID deaths. They were like due to malaria, tuberculosis, or any other illness. Number of home deliveries increased, and we all know the risks associated with home deliveries. So we faced this particular problem in the month of March. We realized the women are not reaching the hospital. So we requested the government that we are going from village to village, creating awareness, and we opened up a ward for these women, and we asked them, you come and stay with us during the last month of pregnancy, 15 days, 2 weeks, 3 weeks, whatever it is, and you deliver in the hospital. So we have around 10, 12 women at a time staying till they deliver, and they go home after delivery. We also there are quarantine camps for the people, for the students who were in city and came back when the lockdown was lifted. So these people, you know, PPE and all those stuffs were not easily available in most of the places. And in such places, they are even more so. So we made face shields and masks for the health workers who are working in the quarantine ward, the cleaning staff, or the people who are providing food. We provided them with these facilities so that they can work in a fear-free environment and they are risk-free.
So that actually leads me to my second question, which is really, could you describe better how you see the situation for PPE and supplies, not just for your particular area, but more broadly in India?
Well, initially there was shortage of PPE because it was not there in the production, and later when it was made available, many of the institutions provided it just to the doctors, not providing it to the nursing staff or the other paramedics who are working and who are equally exposed to the virus. So that led to, it was a discrimination of sorts in a way. And in some organization, it was not provided, especially in some of the medical colleges, it was not provided to the resident doctors. And the reason was being given that we are keeping it for the rainy day when there will be a bigger wave of COVID. So many doctors were exposed and fell sick. And after the lot of hue and cry and doctors threatening to go on strike, they started providing. But many people complain that quality is not as good as it should be. And you know, in India right now we are in summer, and you know the temperatures, and many of the government medical facilities do not have air conditioning in ward. Like you saw our ward, it's a huge ward with 30-40 patients lying on beds, and there is no air conditioning. And imagine wearing that whole body suit with all covered and no AC. People have been falling down due to heat exhaustion, due to dehydration, and with all that you cannot drink frequently, you cannot remove all, you have to literally de-scrub yourself and drink water. So that has been a bigger problem in India. Now many companies have come forward preparing, but first few months, first 1.5 months, when there was no postal service, there was no courier, and people were really stuck. But many people came up with ingenious ideas and tried to make it work for them. It was really a lot of creation was done to overcome this situation.
Yeah, I think one of the key participants in this dialogue had reminded me earlier how important it is to really come at this not from a global north or global south mindset, but really to remember that we are all sort of coming to this global pandemic on equal footing in some ways, and that we should bring down any structures that show, you know, any top down or global north to global south. In fact, there's a lot that we can learn from how India has handled the epidemic. Anagha, would you share with us some of those bold things that you saw or things that you thought were really, really good about how India has handled the epidemic?
So one thing is that we all know about migrant workers and people who lost their lives on the way, as Taji mentioned, and it has become a big issue. So before government could take any actions, I'm not blaming government because probably they were busy on other fronts managing other things and this did not catch their attention. Many organizations came forward, many individuals came forward. People on their own stood on the path, stood on the road, provided water, food packets to these migrant laborers. I know of many organizations who managed to uh, uh, get buses, arrange transport and food packets to migrant laborers and drop them off into their cities or villages from where they are. And this act, selfless act of uh, taking care of the last people in the line, last who we don't really think about them. That is very bad, but it was very nice, very generous of them to think about them. And when everybody was focused on COVID, how to provide PPE, how to whether to give hydrochloroquine or doxycycline or azithromycin, whatever. Some people thought about these rather than just discussing government failure. They came forward and they managed the situation very well. Then there is the issue of people. There were people who were careless, regardless about lockdown, quarantine, and they would move around, and police had to use force to push them in. And then there were people who were panicked and so selfish, they couldn't see right and wrong and prevented some of the doctors or medical staff from entering their own residence, the residential complex. In such drastic scene, there were people who took care of the family of the medical staff who were busy working in the hospital. There were neighbors who looked after the family, provided food for them if the woman is working or if the children are alone in the house. So we could see all the emotions, all the feelings, all the range of people's qualities over here. And I'm glad that, not glad, but only in tough situations like this, we really come to know the value, human value, what we learn throughout the, what we call sanskar. These are the sanskar which really show us who we are.
True. It's all over the world that we've seen this kind of resilience, I think, and coming together of communities, even communities with inequities. There's just one last question, and that is, I mean, one of the big things in our news is really about inequity. We are facing both a pandemic of COVID-19, but also an epidemic of racial injustice. And I know that many people have, from the Indian community here, have risen up to speak out against racial injustice. I wonder if you have an opinion about what's going on here and how it applies, if at all, to the situation that you see.
Discrimination of any sort, by color, by religion, race, caste, or gender, for that matter, should not be there. We all are human beings. We all are living beings. Our color, our education, our position does not give us a higher status or higher powers over somebody else. We have seen all throughout the history how this discrimination has led to even worse things so far. And violence leads to violence. In a way, it should not be, Gandhi said, then Martin Luther King Jr. said, but in that moment of heat, people do resort to violence. And people, educated people who can have ability to think, should raise their voice, because if we don't, who will? If we don't stand for the people who need our help, what is the use of our all education and all the status which we are having?
So true, and so eloquently put. At this time, it's been about half an hour. We will move to questions from the audience. There are some key participants in the audience who have expressed an interest in giving some questions and also speaking on behalf of what they are doing. So I would invite Dr. Shriram Shamsundar, if he is on the call, to please unmute and speak.
Hi, I am, and you see, I'm actually in my car, so I apologize. Can you all hear me? Was there a specific, I joined a little late, was there a specific question to speak towards?
We were just on the topic of race ethnic differences, and I wondered if you could also relay some of your work with Navajo Nation.
Sure. So in Navajo Nation is actually an indigenous community in the United States, in New Mexico and Arizona, and it's actually the size of New England. It's 27,000 square miles, and you know, I was there for 5 weeks. We still have a lot of teams that are there in Navajo Nation, and it's really been one of the main epicenters of the COVID crisis here in the U.S. And so for a while, the level of per capita cases was higher than New York and New Jersey. And I think the U.S. story is very much the story of not having a strong public health system. And so when you have capitalism driving your health system, and you've made healthcare not a human right, but actually a privilege, or for the few, I think you can see what has happened, because I think nobody really expected the US to be put on their knees by COVID the way that it has been, the most cases in the world. And then if you break down the demographic data, it's almost all Black and brown people. It breaks down on race, it breaks down on poverty, and Navajo Nation in particular, I think there's many layers of the history of the United States that is coming to bear in this moment. So, long-term neglect of indigenous populations, and in India, there's Native Americans live in several generations in a house, and so there's in a small house, there's great grandparents and grandparents and children. And so we're seeing a lot of family clusters of infection in Navajo Nation. And then, a third of the population does not have running water, which is obviously common in India, but lack of electricity and running water, like sheltering in place is maybe an inconvenience for people that are on the call, but is an impossibility for many people around the world. And certainly you don't have a fridge, you have to go source water. All of those things make it much more likely that it's difficult to shelter in place. And then the health system for Native people has been underfunded at the rate of like a third per capita compared to the Medicare, which is one national program, and then obesity and diabetes and all of these things that drive the epidemic has been in a place where it has a lot of food insecurity. So there's 13 grocery stores, and in a huge amount of land where in the size of West Virginia, where there's like 162 grocery stores. And so you can see that this population is vulnerable, and they're really paying the price of that. And so I was there taking care of a lot of very ill COVID patients that often, if they get intubated, they have to get flown out to other parts of the country. But we were taking care of, I probably saw hundreds of patients over those last 5 weeks that were COVID positive. And many of them, there was like 175 that were homeless. And there was an outbreak at a alcohol detox center. And so we were putting them in motels, and we were managing their symptoms. And then there was a lot of patients. I took care of many siblings at the same time. There was one time that
I'm sorry.
Go ahead, sorry.
Sorry to interrupt, Dr. Sriram. Thank you for sharing your experiences, but I just wanted to make sure that we have a lot of questions and we go through that. So don't mean to interrupt you in between, but just wanted to make sure that everybody gets attention. Go ahead, Kala.
Oh, thank you so much, Dr. Shamsunder. That was really amazing. A lot of really, really good information. And what I'd like to do, just being the epidemiologist, to draw the parallel here, right? It's what Dr. Sriram was talking about. It's like a lesser developed country within our country in the US, right? And in so many ways, what he was talking about, the high rates of illness in Navajo Nation really, really are, bring home how forceful this epidemic has been, even here. But back to you, Dr. Amte. There are several questions that are on the Zoom chat, so I'd love to hear your thoughts about these. Relating to one of Dr. Sriram's points, really, he talked about how comorbid illness in Navajo Nation patients made them more vulnerable. And we know that diabetes and other comorbid illnesses are also very, very common in India. What do you think about that? Has that led to more COVID illness or more illness in general? What's your opinion?
Thank you. Diabetes has been on rise in India, and India is housing a number of diabetics, and that has COVID deaths or COVID incidence has been more in diabetic patients, old age patients, people with respiratory illnesses. And due to lockdown or non-availability of routine medical care, many of such illnesses have worsened. People are not very thoughtful about diabetes because you don't see the effects of diabetes right there in they are long-term slow effects. So people think, okay, let it be. So what if I miss my tablets for a few days? And when initial few days, when everything was closed down, many of the pharmacies were closed down, people missed their doses. And that has led to the increase in diabetes. But now many organizations are coming forward to take care of other health-related hazards than COVID, because most of the government or many are focused on COVID itself, but other illnesses are taking their toll. So people are now focusing, and hopefully the situation should be in control pretty soon.
Here's another really interesting question by Malini Satya. She wants to know more about innate immunity, and I think what she means by this is probably the BCG vaccine, and whether you believe that the BCG vaccine or other immunity would put Indians or people in the South Asian context at lower risk. What's your opinion there?
There have been 2-3 opinions about the low death rates or low incidence among India or Pakistan or such countries who are vaccinated for BCG. But there have been conflicting evidence, like Indians who received vaccination and then migrated to United States. Some studies show that these people are at equal risk as the rest of the Americans. The BCG vaccination is not providing additional. So it could be multifactorial. That one thought process is that the COVID virus in India has not undergone as many mutations as that in Europe or United States. And secondly, temperature or the genetic or being exposed to many viruses over the lifetime. Probably that has helped. Then anti-malarial also, many of Indians have been taking anti-malarials at some point in their life. So right now it's very conflicting, because one day one paper publishes one thing and second day, like Lancet says one thing and the Lancet takes back its something like Lancet does that, then you don't know whom to believe.
Yeah, we didn't even know RVIX was a journal before now, right? So I think it's all this retraction, and it's very hard to keep track of all of what's going on and what's really the true science. But it's good that we have you here to sort it all out for us, and also experts like Dr. Shamsundar. And then there's yet one more expert that I'd like to call upon, if it's all right, Dr. Priyanjali Datta. Would you kindly unmute yourself and tell us a little bit more about what you're doing and also how it relates to the conversation?
Well, thank you, Kala, and thank you, Lata, for inviting me today. It's a privilege to talk to you all. So I'm streaming in from New Delhi, and what I do is I run an organization called Arogya Foundation. We have been working in since past 3.5 years for detecting and preventing common cancers in women early at a community level in a decentralized manner by upskilling the primary health workers, the healthcare workers, which are the midwives, and the door-to-door health educators, which are the ashas in India. So that has been our core work. In last 90 days, what we pivoted into was to intervene the infrastructure, the existing infrastructure that we had, to help the migrant workers receive essential healthcare services while COVID had blocked them from receiving so. Hence, the frontline healthcare workers right now are visiting door to door 7 to 8 families per day, and they are 1 million in number in India right now across 700 plus districts. So they are practically very exposed to the infection, because migrants have recently started traveling by train from the tier 1 cities to the tier 3, tier 4 areas back to their homes. So a lot of patients are coming to us from Bihar, Jharkhand, Deoghar, where the Sawan Mela happens, and in Gujarat, where we have received patients saying that, okay, I have COVID-19 symptoms, but where do I go for testing? And the frontline health workers do not have the equipment, even basic mask and sanitizers to carry on their work. So it's been a challenging, it's really been challenging. And I second to what Dr. Sriram said and Dr. Anagha said, that India does not have the proper public health infrastructure at a community level. And that is why it is going to go a little more worse at this point when we have started to climb the peak. So our attempt has been to digitally equip them to have low contact and contactless symptom assessment for essential healthcare and COVID with the migrant with the migrant labor families. So that's been what we have been doing.
Really excellent work, and so glad that you made the connections there between, basically the public health infrastructure, and really how when you have less of a public health infrastructure, that it can have so many different ramifications. One comment from the audience was really about migrants and transportation. So this is a question for either you, Dr. Datta, or you, Anagha. How do you feel that transportation of especially migrant workers has influenced the pandemic?
Dr. Anagha, do you want to take that?
You can speak, then I can add a few things.
Sure, thank you. So transportation has been a challenge in March and April and May for sure for them. We have literally found out more cases because there was no practical social distancing. They all were on foot back to their houses, and they were using public toilets. So there was absence of practical social distancing, and it is not possible in a country like India where we have 133 crore people. Hence, the transportation, I think, have now started getting better when people have started taking initiatives along with the government to make groups and send them with proper face shields and through flights, and they are also taking donations from people to be able to send one cluster from one place to another back to their home. So I think in June it started getting a little better, but before that, I'm afraid that the infection must be already uh, have been carried a lot. So we will see by end of June what is the condition.
Okay, thank you. And Dr. Amte, would you like to add some?
She has covered most of it and she's directly involved in this, so she has better knowledge. As she correctly said, the government was not involved initially, so that was the time many organizations came forward. The government opened the railways later in May when the people could go. And one good thing which government did, which I see in our area, is proper quarantine. People were quarantined, people were provided with food so that they are properly taken care of. Of course, in some places, the toilets were not in a good, in India, you know how the toilet is minimally equipped or sanitary. So those created a little problem for people. Some people are not used to using toilet; they were used to going out in the nature. But that did pose some threats. But now government is taking initiative and quarantining people who come back from migrant laborers who come back to their homes and they are tested, and only after that they are released.
Yeah, very good points. Would you like to say anything more about the people who are sort of most marginalized, as we've sort of been on this topic with migrant workers and the more marginalized communities? You had said that you, of course, work with tribal communities. And how do they view, have you talked with any of the folks from tribal communities? How do they view COVID? And what do they think of the situation at the moment?
Uh, Initially there was a scare among the people. Some people did not know at all what COVID is, and some people were scared that some illness is coming from cities to our place. So some people literally put barriers on the in the entrance of their village, saying no entry to the outsiders into the village. That was surprising that people knew something like, and they had written banners, because of COVID-19, we are not allowing anyone to enter our village. So we decided to make them aware what COVID actually is, not to hype it up or not to play it down. So we used our vehicles and megaphone and went village to village telling them what COVID is and how you protect yourself and others from this, and how you should keep people who come from the outside in a quarantine. They have a common community house, keep them over there, and after 15 days release them. So it was a mixed emotion, but people were getting aware, and now also when they come, they don't have masks, but they take their dupattas or anything and they tie it around their, they cover their nose and mouth and they come. So awareness has reached them.
Is there any data or your feeling that the tribal population may be less prone to getting COVID? Is that one of the responders in the audience has suggested that maybe not eating processed foods, eating raw foods, or make them less prone to having an immune response or mounting an immune response? What do you think?
There is no data, but I guess there are multiple factors along with what you mentioned, non-processed food. Then it's not a congested area, it's free from pollution, and they are not having the risk factors like diabetes or pulmonary diseases like COPD, which make them more prone, and probably living not very clustered or congested lives has helped them, and probably some genetic factors as well, which are protecting them. Because so far we have detected around 40 people with COVID positive who came back from Bombay and Pune, but none of them no deaths so far. Even if you take 3%, there has been not a single death.
Yeah, sounds, well, I'm so happy to know that there haven't been any deaths yet. That's promising. I guess another key area that you work in is really in women's health. You brought that up in your slides. And I know that there's another guest on the call, Maya, who's no stranger to Aika, who works in women's health, particularly with the making of feminine hygiene products. So if Maya, if you're on the call and you would like to unmute and share your story and how it relates to our conversation. Perhaps she's no longer on the line. I did see her before. So we will quickly move on to talking more about women's health. Could, you know, a lot about the conversation here in the US is about how particularly women's lives have homeschooling their children. I wanted to ask you particularly about women and how you feel they've been impacted in your environment.
Sorry. Luckily, the women or the entire population has not been affected by these, other than the medical facilities which they are, or lack of transport which they were suffering from. In the village itself, people are moving around freely, they are talking to each other, and children are free to move around, go to the forest, play whatever games they are, because it's an open environment, and the villages are so remote that there is nobody goes there, no law enforcement goes there to check whether people are staying in the house, because their house is not just their house, it's the entire village, and the surrounding constitutes their house. So the lockdown does not really work over there. So as in the rest of the world, as the domestic violence has increased, or child abuse has increased, or the addictions have increased, we do not see those things in our area. Things are good or as they were in the past, besides, of course, some of the medical facilities or medical care which is not there.
Next, I'll call on Dr. Pratima Pandey. She has a question.
I wish I was a doctor. I'm just Pratima. Thank you, Anagha ji. Nice to see you again. And thank you, Kala ji, for moderating. And also Dr. Priyanjali and Dr. Shri. I wonder what the long-term planning is for healthcare facilities to deal with the insurge of patients once the shelter in place is lifted. Earlier in the talk, especially with respect to women's health, you were talking about how women were giving birth at home in much larger numbers. Related to that are statistics around children missing vaccinations and other ongoing healthcare needs that people have had to pause. So I worry about how healthcare systems globally actually are planning, and I was wondering if you could give us some insight. And then Dr. Datta, if you have any additional points, it would be an honor to hear from both of you. Thank you.
So that's an interesting question, and it has been worrying all of us. What's going to happen now that the lockdown has been lifted? People are actually rushing back into streets, and the numbers are predicted to rise. And most of, or you can say almost all the medical staff, including the community health workers like ASHA and Anganwadi workers, are moved to the COVID task force. So all the other points are being neglected, and I guess it will be, the onus will be on the organizations like ours, like Arogya Foundation of Priyanjali, to take care of these health needs, because this is going to be really a big problem when these needs, and if you see in countries like India, diseases like malaria or even anemia are bigger killer as compared to COVID. So I guess we have to think about it and find solutions, join hands, work with government. Priyanjali, could you add your thoughts, please?
Sure, Dr. Anagha, thanks. Yeah, so to answer to that question, Pratima, I think that's a very crucial question that you have put forward. And I think it won't happen in a few months. It will take some time because the idea is that if you, there's a data which say, there's a research which says that for 133 crore population, if we go on building infrastructure of healthcare facility, it will take another 100 years or more. So the only way we can do is upskilling and enabling the frontline healthcare workers at the grassroots pyramid, because in India, we practically have less than 25 healthcare workers for 10,000 population. And amongst them, doctors are 6 to 7 in some states. Rest of them are nurses and midwives. So I think the gap is that we have always made the healthcare facilities available in a centralized manner in urban areas, which has produced a lot of influx and outflux of people to particular cities only. But now I think COVID will hit everyone very hard into realization that centralized healthcare system is not going to work post this.
Yeah, I think, it's going to challenge healthcare systems to pick up on both of your points, to really arc and change to a new model, right? We're going to have to arc and change to a new public health care infrastructure model for many countries. And how we envision that is really going to be critical and key. There's a couple of other really fantastic questions. May I ask Shubho to unmute and ask your question, please?
Sure. Dr. Amte and Dr. Datta, this is for both of you. But I'm curious, I posed a question about a positive message around resilience and indigenous population or tribal population demonstrating more resilience than others. I think that was answered. But I'm curious, you mentioned 40 COVID positive patients who are doing relatively well. I'm curious if they are also asymptomatic. I'm just grasping at straws to see if there is any evidence of good, healthy lifestyle and being able to resist the severity of COVID. Is there any?
Yeah, all of them were asymptomatic and they were detected during routine testing of the migrant people.
Okay, so not to jump at conclusions, but that seems like a positive message here, that you have a population of folks who are living relatively natural lifestyle, perhaps not eating fried potatoes and chips and processed food, and somehow leading to asymptomatic conditions and perhaps being able to deal with it better. Is there some reason to make that conclusion?
I don't know, epidemiologists will be able to reply to that, but I suppose indigenous population all over India, maybe Priyanjali could add a little more to that, have been showing more resistance to the infection. The causes we'll have to find out.
So these are all great. There have been small case series that showed promising results. For example, we thought that convalescent plasma might be a good solution, right? Using the plasma of people who had COVID and then recovered to then inject into people who had it. And the early trials showed some positive benefit, but a randomized control trial did not show benefit. So, I think what's really important to know is that these early markers must be tested really to sort out what is actually true. And that's the science of good clinical research or good epidemiology. So I guess the answers are coming still. I think we have a question.
Sorry,
Yes.
just to keep a track of time, right now we're at the hour, so
Yes.
probably we should be able to take one or more, two questions.
Yeah, I was just going to do one more question and then go to the agent of change. So here we go. One more question, I believe, is from Malini Satya. Could you please unmute and
Yeah, hi. I just wanted to ask all the doctors on the forum what your thoughts are on testing. And India seems to be doing pretty well with testing based on the numbers that we see. Until vaccination comes along, I guess that's our only path forward. And I wanted to see what you think about its reliability, availability, basically, at least in the Indian context.
Well, there have been conflicting reports about testing. Some states are doing testing only for symptomatic patients, whereas some states are doing for all migrant people and all people who come with the symptoms suggestive of COVID. And some states have been playing it down, not testing, just to show that they have lesser numbers in their states, and they have given funny reasons, saying that if they have more numbers positive, then it will create panic amongst the people. The reliability is, of course, again a point for analysis and study. Delhi government has recently closed down 4 labs because they were not following the ICMR guidelines, Indian Council of Medical Research guidelines. So I guess the government is keeping track about the reliability of the test, and hopefully it will work out.
What do you think, Dr. Kala? Is it any better here in San Francisco locally?
So that's a really good question. UCSF, where I work, Dr. Carol Byrne did a test of the tests, so to speak. And the sensitivity and specificity of the known tests, there's quite a few manufacturers of the tests, varies greatly. And the lower bound is a sensitivity of about 70%, which is not great. And the higher bounds are in the 90s. So it's quite a range. And so I don't actually have any data on any of the Indian tests, so I can't make an inference. But if the interval is that big, then we have to be very careful about what tests we're employing. And also, one other piece of the added variability, to get a really good RT-PCR test, you have to shove the nasopharyngeal swab way up into the nasal cavity. Right. And it's very uncomfortable. And so, I'm just guessing that it's not perfect. And so, yes, and I think Pratima would like to share some of the Santa Clara County's views on testing, if we can open up her.
Oh, thank you. Yes, just for those of you who live in Santa Clara, I want to share that the County of Santa Clara is encouraging people to look up the testing locations. You can go to Public Health or Santa Clara County Public Health COVID-19 testing. Please consider getting yourself tested. The county will offer you all information online on what type of testing and what is the process. If you want information via the phone, please call 211. The county is hoping to get up to 4,000 people tested a day, and the testing is free regardless of whether you have insurance or not, and language services are also provided. So please consider. As well, the county is asking for people to volunteer as contact tracers. So you can look up the Santa Clara County COVID-19 website for that information as well. Thank you, Kalaji.
Oh, no problem. Yeah, we're serving the South Asian community in India and here, so it's good to have good public health information for everyone. But I think this whole conversation, we've touched on so many points. Rural and migrant, we've touched on women's aspects, we've touched on how COVID has impacted India, we've touched on many different other key topics. But the overall question that keeps coming, the most important one, is really, in this, how can you become an agent of change? How can you motivate yourself hearing all of these bits and pieces of information in the health sector really motivate? And so Dr. Amte and anybody else who would like to participate with this, please would you share with us, how would you encourage others to take action?
That's an interesting question. Well, I believe in what Mahatma Gandhi said, be the change you wish to see. We see so many things wrong around us, maybe healthcare, maybe public transport or anything, and we just keep talking about it. Government is not doing, we expect someone else, government or anyone else, to change these things. But we can begin with ourselves, start from our house, from our families and friends, and start doing these small changes and join hands with other people, other organizations to take it to a bigger level. We cannot expect a government to do everything, because what is government? United States or India are both democratic nations. And what is democracy? Democracy is of the people, for the people, and by the people. I feel it's time now we realize the democracy and we took active part as citizens in this democracy and play our role. It may not be just doing as a teacher just to teach. We can do little more, motivate and take part in some of the social activities and lead the change, be the agent of change. It may not be big. It could be anything. You could be a fundraiser. You could be organizer for some rally. Everybody has some strengths, and we can play by these strengths to achieve this change.
Absolutely, so well said. And in wrapping up, we have an example of somebody who from ICA went to India and it demonstrated being an agent of change, and that's Maya Vishwakarma. Could I please call on her to share how she motivated to become an agent of change and tell a little about her story?
Hello, hi everyone. How are you doing? Sorry, I was late here. So nice to see. And I spoke to Lataji a few days back, and she encouraged me to participate in this one. So I missed a lot of part, but yeah, I would like to contribute like what I have seen in my 3-month journey here. It's incredible. I heard Angana that Anagha, that she's telling about the government and other policies here on the ground. And I really, I tell everybody that those government policies and government system is really collapsed here in terms of healthcare, because I can see in my village and this area is totally messed up because people are dying and they are not even getting the medical help. And yesterday I was in a really remote village, and it is kind of tribal, and it's not too far from the city, only 8 miles from the tehsil, which is called like a big government hub, but still there are no facility. I mean, they don't get any facility. Like TB patients are dying like anything, and they don't know the cause. And they are not the older people, they are young people. And especially this corona, we haven't had any died person here due to corona, but hundreds of people are dying without, with other diseases. So this government system is really failed to serve other people beyond this corona. And if I talk about the menstrual hygiene, because we've been working last 3 months here and distributing the ration and other necessary item for the families who really need help. So we started distributing these sanitary pads, and due to this corona, this problem really arise because the supply and demands went, that ratio went messed up, and So the people are not, these women and girls are not getting the pads because the transportations and the officials, they start working on corona, not on the other essential stuff. So the menstrual hygiene, women health, and these, like, you know, pregnant women even, most of the women, they are giving birth at home. They are not even reaching the hospital, and private hospital, they shut down because they cannot take this risk. They are not admitting the women and the patients because they are fear that they could get corona, or the patient get corona. So that's the other way around, that the government, they haven't even prepared that what will happen these other patients. Like I can see in my village, in 2 months, 10 people died, and without any treatment. And some of them
That
are,
is,
they could be like, you know, recovered. They could be like, you know, they can get treatments on time. Even the financial crisis is a biggest here, because the jobs are not here. People, they migrated from other state or other villages. They don't have any work, and they ran out of the money because they are eating at home last 2 months, 3 months. So this condition is really worrying me, because I can see directly, I can talk to the families, and I'm visiting every day. I'm visiting like 2-3 villages in tribal areas. And before that, we had a big setup that we were serving thousands and 1,500 people on the highway, and we are feeding food. And also these because it's a high heat, so the ORS and all the supplies, including menstrual hygiene, these sanitary pads. So I would like to give a few seconds on this, because I feel this was, I mean, this address was ignored in our society. Those migrants who were moving towards their home, because they need to reach their home as soon as possible. So they were compromising each and everything. Like those women, they were not drinking water because they had to go to the toilets. And they were sitting somewhere in the truck in the corner with 100 other men. And forget about the pads and forget about their other items, but they were just, you know, eating less and drinking less water, so that they don't have to go for you know, the toilets and other things. Because the truck people, they were not stopping those truck at some station, like the gas station, they usually have toilets. They were stopping somewhere in the road. So then they had to go under those bushes and, I mean, the urinations and all that. So we spoke to few women, and we used to give those pads, and they said this is like, forget about these sanitary pads. We are not even getting the simple clothes, because we were out from our our home. Not, I would not call it home, because they were going towards home, but wherever they were staying, they were out for like last 15 days, because they were walking hundreds of miles, and they were fighting for the food and small things. So these things they were not carrying, not medicine, no pads and nothing else. So then we figured it out, like how can we help these women. So we gave them, no matter what, like if they required or not, we just give them a couple of boxes so that they can keep. And if there is anybody, like, you know, in the on the way, they can give it to them. And we also put the pads to the bus driver. I mean, there were bus who were carrying all those migrants labor. So we put some boxes in few buses, so that those driver, they can give those pads to the women, whoever they were carrying.
Sorry to interrupt, Maya. I don't want to be insensitive to it, you know, to your discussion. I think it's very heartbreaking what I hear about this, but I want to be sensitive towards everybody else's time also. So it's kind of a little late on our side. So if you can be a little brief, that would be helpful.
Yes. So this is what I'm telling, those stories from the ground, and we are still working. with the families who really needs help, like this ration and other medical treatment. Those older people, they don't have money to pay the private hospitals or the big government hospital. Anyway, they are not working. They are not seeing the normal patients, as Anagha also said, these stuff. So yeah, this is my experience, and I feel very lucky being here and on time, so that I can help directly. If I stuck in US, forget about these helps. So it's a really good experience, and thank you so much for having me in this panel, and great to hear all of you.
Oh, what an amazing story of, you know, she went to India, she was there, and has from Micah has become such an amazing voice of change. Dr. Anagha, thank you so much. You were already, you know, born and married into a family of change. So thankful that you're teaching us here how to be agents of change. And I'll hand it back over to Lataji.
Oh my gosh, thank you all. I don't know what to say. What wonderful stories we heard. I mean, you know, I didn't know this was going to be depressing about how bad the COVID thing was going to be, but in fact, it was the other way around. It was so positive. Everything I heard this evening was so positive from everyone, from all over, from here, what's happening here in the US, and also more actually optimistically, I was looking at what I was hearing from India. Okay, all the stories. And so with this, we are going to be closing this session. I want to thank all who were engaged with us today. Thank you to our special guests, Anagha, Amte, and others, Dr. Sriram, Dr. Priyanjali, Maya, what wonderful stories we heard. And others who have joined us from India, and our moderator, Kala Mehta, for an exceptional job. And I want to thank you all. And I hope this gives everyone time to pause and decide on the kind of action that will benefit all those who want to reach. Just a few final thoughts. The speakers, as well as you, the audience, have been inspirational. Hope you all will continue to learn about these issues and think about the real implication the COVID-19 has on social advancement and implications on the organizations doing that work. Most importantly, I invite all of our audience members to get involved and take action for a better world and make it through these challenging times. We wish we could have been with you in person, but maybe next year. Please provide your feedback to the survey that you'll be getting in your mailbox, and stay tuned for our next virtual meeting, which is going to be on environment on June 22nd. We may be changing the time to a little earlier. Please keep an eye on for that. Thank you, everybody. We'll see you in a couple of weeks at the next one. Okay, thank you. Good night.
Thank you, everyone.
Oh, good morning.
Thanks, everyone, and good morning or good night.
Thank you.
Bye.
Thank you, everyone.